Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Good morning, Philippines. You're watching the Business Portal, your gateway to health, beauty, trends, and opportunities. I'm your host, Dr. John Cenica for What's Up, Doc? Yes, and what a very shiny morning. And we have a very interesting topic. It's all about oral maxillofacial surgery. And before anything else, I would like to introduce to you, of course, my favorite, my co-host, an icon in the industry of cosmetic surgery, no other than Dr. Rayran Lao.
Good morning,
Dr.
Dr.
Lao,
Cenica.
how are you?
Yes, I'm good, and good morning to all the televiewers of GNN, especially What's Up, Doc.
Yes. And Dr. Lau, this is kind of a kind of different topics because we'll be talking all about teeth, all about surgery,
Yes.
all about implants. Okay.
Actually, ang mga guest natin is oral and maxillofacial surgeons.
Ang guest natin is an icon in
Yes.
oral
And
maxillofacial surgery.
I believe sa Philippines, less than 20 or less than 30 pa lang ata ang
I
mga
know.
nagpa-practice na ganito.
And I say that, ang oral maxillofacial surgeon parang napakahabang pangalan, no? But we will, our guest will give us some information regarding what they are doing. I thought it's just, ang dentistry is just,
Tooth
extraction,
extraction,
cleaning, pasta. Pero
Marami pa pala.
there are a
Yes,
lot of
oo.
subspecialty pala in the
Yes, and hopefully
dental medicine.
madidiscuss natin ang OMS, yung oral and maxillofacial surgery, at ano po yung mga procedures na ginagawa pa.
Yes.
oo.
Okay. So let's start the ball rolling. Our guest for this morning is, of course, an oral maxillofacial surgeon, the chairman of the Department of Dental Medicine at Mary Child's Hospital, and an executive vice president of the Philippine Dental Association. Big time talaga. And of course, he is a mahaba masyado.
Sobrang haba na introduction ni Sir.
A cleft lip and
Palat Committee Chairman of
Chairman.
the Philippine Dental Association.
Yeah, there you go. And of course, he is a reserve officer, a full colonel, the very first full colonel in the dental medicine in the armed forces of the Philippines,
Yes.
and is the acting brigade commander of the Northern Luzon.
Command Reserve Force of the AFP.
Yes, no other than, of course, Dr. Carlos Buendia, a Rotarian. Ayan.
Good morning, Dr. Carlos.
Good morning to Dr.
Good morning,
Lao and Dr.
Kaloy.
Cenica. Thank
And
you.
our next guest is Dr. Lau.
Yes, he is also an oral and maxillofacial surgeon,
Yeah.
a resident of Dr. Buendia,
Uh-huh.
Dr. John Romero, or Doc John.
Doc John, hi.
Good
Pangalan
morning,
ito
Dr.
kayo.
Cenica.
Ha?
Good morning.
Good morning. Yes, we don't know that dental medicine have a lot of subspecialty. We consider oral maxillofacial surgeon very broad on term. Hindi kaya nagkakaroon to ng conflict between yung mga ENT, plastic
Yes.
surgery, regarding oral maxillofacial surgery. But let's define first
Yes.
what is oral maxillofacial surgery, Dr. Buendia.
Oral maxillofacial surgery in the United States, it is defined as the surgery to correct a wide spectrum of diseases, injuries, and defects in the head, neck, face, jaws, and the hard and soft tissues of the oral and maxillofacial region. Now, the Philippine Dental Act of now, which was amended, clearly states that the dentist is authorized to treat medicines, to treat patients' dental problem, to include prescription of medicines, and also treating the diseases of the teeth, gums, jaws, and surrounding tissues. So
Right.
this is actually the head and neck region, or the oral and maxillofacial surgical region.
Okay. But for our televiewers, of course, you can text your messages at 0922-891-6761. And we are broadcasting live here in not broadcasting. We're broadcasting here on the Global News Network and here in WhatsApp Doc. Of course, please indicate your name and your address.
location.
It's right there in
Yes.
your screen. Again, it's 0922-891-6761. And we can answer all your questions regarding, we're talking about maxillofacial surgery. Okay, maxillofacial surgery, what are the parts of that that's included in the treatment of oral diseases in maxillofacial surgery?
This
Dr. Lao.
actually includes the diagnosis, surgical and adjunctive treatment of diseases, defects and injuries, including both the functional and aesthetic aspects of the hearts and soft tissues of the oral and maxillofacial regions.
Oh, sir, Dr. Romero,
Yes,
ang oral and maxillofacial surgery ba is a field of dentistry lang ba ito or pwedeng or a field of medicine po ba ito?
Yes.
Well, it's nowadays parang combined no? Kasi we have to refer patients to our colleagues like the doctors, the medical practitioners. Once we see patients coming into our clinic, we check the oral cavity for any problems. Tapos we see different infections coming from the bones, no? So this type of procedures cannot be done in the clinic alone, no? So we need the medical side to clear the patient prior to the procedure, no?
So parang
Chine-check
clearance
natin.
po yun, sir,
Clearance,
clearance,
CP clearance, because we have to induct anesthesia in general, no?
Okay. Now, what are these, the oral maxillofacial surgery, we know it's oral, the word speak for itself, and the maxillofacial area. Ano ba mga diseases ang nakikita natin dito, Dr. Buendia?
Now we can actually see jaw tumors. Now when
Jaw
we
tumors.
speak
Jaw
of
tumors.
jaw tumors, this include cystic lesions, this include tumors that are odontogenic in origin. We can see also both the benign and malignant lesions, like we often see squamous cell carcinoma. Just recently, we have done a case of follicular carcinoma. You know, we were surprised because we were thinking that the patient has just had an odontogenic tumor because of the bone expansion and the nature of the bone lesion. We were thinking that it was just simply a radicular cyst. So what I did is to just do a selective block excision of the jaw. It's from the body to the body of the mandible. And I was surprised that the histopath came out to be a thyroid CA.
Thyroid CA.
So I asked her, do you have a thyroid? So I saw that she got a hyperthyroid. Then we were thinking that the origin was the thyroid. So outright, we decided to do resection, then do a reconstruction plate. Then after that, we remove also the thyroid.
Okay.
Because the origin clearly will be seen in the thyroid area, then it went through the jaws. So these are some of the rare cases that we have done now.
Dr. John, when is the right time for, let's say, if I am a patient and I feel something, and when is the right time to consult an oral maxillofacial surgeon?
Well, definitely, una-una, patient will come in for pain, no?
Yeah.
So, kami naman yung nag-screen for the patient using our modern technology like yung mga panoramic x-rays, no? So, initially, hindi naman alam ng pasyente yan, not unless she has
Ano nga ba,
a
Dr.
swelling.
Romero, ang panoramic x-ray?
It's,
Just to be, ano.
Yeah,
It's comparing
napaka-high-tech
to
na ngayon
the
ng
standard x-ray na yung periapical, maliit yun. Yung panoramic will show the whole of the maxilla and the mandible.
Maxilla.
Plus comes yung mga cone beam CT scanning in 3D. In 3D animation, mako-confirm mo yung mga...
In 3D?
Oo, in 3D.
Akala ko sa sinihan
Manipulate
lang ito.
mo, magagamit mo sa planning
40
for
pa nga eh.
cosmetic surgery.
Yes,
no?
yes,
Pagbawas ng mandible or maxilla. O pag-insert ng implant, ginagamit yun. Plus, yung mga diseases arising from the bone or soft tissues, pwede na makita.
So is there an instance, sir, na pag nakakita kayo sa clinic and then you decide to do the surgery, pwede ba on that day agad? Dadalhin nyo sa
Well,
hospital?
most of the time, pagka dental procedure, elective.
Elective.
No?
Okay.
But we have emergency cases, yung mga vehicular. Pero you consider
Can we
this
do
as
surgery like in a dental clinic, like A simple dental chair?
Simple procedures.
Simple procedures.
Simple
only,
procedures.
okay.
Okay.
Like removal ng mga impacted molar. These are done by
Yes.
the OMS. Ito yung mga simple procedures na ginagawa.
Can be done in the clinic.
Oo, yung mga the complicated extractions.
Yes.
Oh.
Let's talk about the most common one, the dental implants, Dr. Buendia. Because we know that kapag natanggalan ka na ng ngipin o binunuto ka na ng ngipin, this will not grow anymore. Okay. Let's talk about at what age pa, let's say for the common audience that when you had like small little kid like the 3 years old, because I have a 3-year-old kid, pangit ng ngipin niya. Then we consulted the dentist, and they said that they're trying to preserve the teeth of my child by not extracting it. What is your comment there, Dr. Buendia?
Well,
When is the right time to have a tooth extraction, or do you have to sabi nga lang, they have to put a jacket on that? Sometimes they put like a jacket na gold or silver for the kids, Dr. Buendia.
There are some timetable. Merong chronologic order kasi yung tooth extraction also eh. When we see that the deciduous tooth starts to wobble, then that's the time that we're always thinking that there's already a succedaneous tooth. The permanent tooth starts to come out, so we have to remove that. But to prevent carious lesion to deciduous tooth, we do sometimes sealant. We put sealant.
Okay.
And sometimes we do put crown. That is to preserve the deciduous tooth. 6 to 7 years old, so that's ideal.
6 to 7 years old is the ideal
6 to 7
time
years old.
for
Until he reaches the age or she reaches the age of 6 to 7, we do sealant, we do crown. That is to protect the temporary tooth.
Just to protect.
Just to protect. No
Is
problem.
it very safe, let's say minsan, that the kids are pulling out their teeth?
Kasi na-resorb na actually yung root.
Oh.
So it's mobile, tinutulak na siya ng darating ng ngipin. Napupudpud yung root actually. So
Okay.
kayang galawin ng bata. So not necessary to bring them to the clinic, but advised to use clean fingers or hands every time, di ba? Pero kung talagang nandun na yung ngipin at nasa likod na, nandun na intervention ng isang
At what
dentista.
age does this tooth, you said that pushing the...
Nag-uumpisa?
Yeah.
Mga 5, starting for 5 years old, pag sa mga harapan ng ngipin, may
5
mapapansin
years
ka
old,
nagkagalaw.
nag-start na.
Nag-uumpisa sa pinakababang.
Sir, pinag-uusapan natin mga 5 years old, 7 years old. Pero pag mag-i-implant, kunyari, o may mga procedures na gagawin, alam natin na mga bata magulo, takot sa injection.
Yeah.
Pinapatulog niyo po ba ito?
Did you have to sedate the patient?
yes.
Sometimes, but we avoid conscious sedation because we are not encouraging that.
Yeah.
If you want to put the patient to sleep, we always intubate the patient for fear of aspiration.
Correct.
Always intubation, sir.
Yes.
Always
Intubate.
intubation.
We don't.
So
I
you-
myself, I don't encourage conscious
That's
sedation to
true.
my patients.
Like putting
Yes.
sometimes they do
conscious
sedation inside the clinic, no?
That's
I know-
very
I know-
dangerous.
Very dangerous,
Oo,
and
kasi-
then just
Yes.
IV, no?
Oo.
IV lang.
And I
Nauna,
know
walang...
some
Just in
of
case
the-
something happens,
machine,
that's
oo.
it, you know.
And I saw some practitioners doing that, but for me, I don't encourage it.
Oh.
We have anesthesiologists anyway to
Of
do that
course,
for us.
yeah.
Yes.
Because
It's
one
very
reason is how can you monitor and at the same time operate on the patient?
Yes.
Yeah.
So that's very
Pero sir,
dangerous.
kunyari,
for
in
me.
an clinic setting, pwedeng nandun yung anesthesiologist,
Yes,
pwedeng gawin yung
pwede.
procedure na.
Pag-equipped.
Pag-equipped.
With,
Provided
If you have
you
an
have-
anesthesia
yes.
machine,
Anesthesia
the
machine.
gas, pwede po.
Provided you have an emergency, let's say you have the
Yeah,
recovery
emergency
room
kit.
complete, your recovery room is complete with amenities to sustain your patient and also even ICU.
Yeah.
But if you don't have those requirements, I won't recommend.
It's not
Isang
recommended.
very
question, Dr.
simple.
Buendia, what if, kunyari, ayaw ng mother to consent na patulugin yung bata? Sabi niya, Dr. Buendia, gawin niyo na po lahat ng pwedeng gawin, basta wag niyo lang pong patulugin. Pwede bang ano to yung mga
Minsan,
ginagawa?
ginagawa
Oh,
na,
but
blanket,
Tinata, mga
Right.
blanket.
Pwede yan.
Okay.
Yeah.
Isang
See, sometimes
bata
for the
pa
kids,
rin
it's
siya
very
na
hard
ganyan.
to be a patient because
Yes, yes, yes.
they always cry, they always,
Yes.
you know.
And makakita lang na naka-white coat ang bata, umiiyak na
Lalo
talaga
na
ang
alam
bata.
nila,
Yes.
pain
Yeah.
bibigay nyo.
Now, let's talk about dental implants. Okay,
Yes, yes.
dental implants is just like, especially for adult like us, and we have this tooth extraction. And ayun naman na, hindi na uso yan masyado ngayon ng false teeth yata doctor,
Yeah.
di ba?
Tama po kayo dun.
So, ngayon, what's the latest about dental implants?
Actually, dental implants is a replacement of a natural tooth.
Uh-huh.
And one advantage is you don't alter the adjacent tooth
Yes.
for a dental implant.
Uh-huh.
So let's say you have one missing tooth. It's some dentists do fixed bridge. So if you do fixed bridge, you alter the adjacent tooth, you reduce it until such time that you are reaching the dentino-enamel junction. So once you reach that, the tooth becomes sensitive.
You mean that the teeth beside that vacant area,
Yeah.
you have to damage it? Parang
Yes,
dinadamage
so,
mo
ganun
na
na
eh.
reduce it.
Reduce it, and that's
So
irreversible now
once
already.
you reduce
Irreversible.
that, the
Yeah.
tooth is already compromised. You're already
Right.
compromising the tooth enamel as well as the dentine. You know.
So doon mo ina-angkla yung
Yes.
teeth ng gitna doon sa dalawang
Yes,
adjacent
whereas
teeth.
in implant, you only put a fixture
Uh-huh.
right there into the bone. Then you get an abutment. Then you have the crown. So you
Okay.
don't alter the adjacent tooth.
Right.
So that's one advantage. So
How long is the procedure, sir, for
Yes,
an
sir.
implant? For one tooth, for example, how long?
you can do it in 15 to 20 minutes, provided
15 to 20 minutes.
Wow.
Parang rhinoplasty. no?
Yeah.
Oo.
Provided you were able to get the correct width of bone.
I thought it's
Yes,
just like when you
density
do
also.
an implant, it takes like several days for you to have that teeth. I mean, ngayon pala is 15-20
Oh.
minutes.
Actually, another way of doing implants is immediately after extraction, you can place the implant immediately to replace
Meron-
it
meron
and
pwede
let
yung
the
ganon?
wound heal.
So, is there any, just like what we are
That's what
focusing
we
right now, you can see some, what do you call that metal? Is that screw?
Yes, it's a
That's a
titanium screw.
Titanium
Yeah,
screw. As in really, it's a
Yeah.
titanium.
Sa
Why
laban.
titanium? Ba't hindi ba pwedeng
Kasi
stainless?
yan lang,
or-
yan lang
It's
naman ang accepted,
biocompatible.
biocompatible with the
It's
human body.
biocompatible.
yung ginagamit na.
So any form of projection, did you experience of that? Even though it's a titanium?
Actually, when we say titanium, it's really biocompatible. For me, rejection comes from the technique of the surgeon.
Oh.
It's not because of the titanium.
Because of the
Okay.
material.
Clinical judgment.
Let's say patients being so hard-headed sometimes. You give them instruction and they don't follow.
So one of
You tell
them is
them to come back,
compliance.
they don't
okay.
come back.
Compliance of
Patients'
the
compliance
patient.
is very important also.
Okay. You mean in just immediate after extraction? That's what Dr. John
You can
says.
put an implant.
Fixture.
Yeah.
Could you resume your activities right after? Is there
Immediately
any
after.
swelling on the outside aspect of the face?
Very seldom. Pag
Very
multiple, pwede.
How
And
many teeth, sir, para masabi natin magkakaroon ka ng swelling?
Mga 3 to 4
3 to 4
implants. Well,
implants.
definitely because of the preparation of the bone. Normal ang swelling naman. ng
Pero pag
human
1 to 2, Dr. Romero,
one unit, imagine
could
tomorrow you can go to your job.
Who are the
activities.
patients who is not a candidate for dental implants?
Patients with these systemic diseases like diabetes mellitus,
Diabetes.
Uncontrolled.
diabetes,
Uncontrolled diabetes.
uncontrolled
What
diabetes
else, sir?
Okay.
mellitus, let's say patients who had undergone radiation therapy.
Radiation
Don't
Okay.
recommend.
Bakit po, sir?
Osteoporosis.
May tanong ko lang po.
Osteoradionecrosis.
Okay.
So do you do workup muna before you
Yes.
do any
Yes.
surgical
Do complete
implants?
blood
Okay.
chemistry.
How about
workup.
hypertensive patients, sir, na
Hypertensive, they can qualify. They
They
can
can
qualify,
qualify.
provided the patient is
Also,
cleared
yung
also.
Smoking.
Smoking should
Smokers,
be
yes.
avoided, of course.
Okay. So, and then you said it's 15 minutes work. You can place the dental implants. And how about yung mga food that have to take? They have,
Yeah,
do they have
so,
any
yung mga normal ba na crispy pata, pwede ba nila agad makakain?
There's
Hindi mo
such
na.
thing as do not abuse.
Okay.
Oh,
For the first
okay.
few months, for the first 3 months, because the bone starts to harden, so
Right.
you have to wait also.
First 3 months.
Yes, first 3 months.
Okay.
That's very, that's very.
Meron ba yung feeling, sir, na parang, ay, kaya ko nang kumagat? Parang ganun ba ang mararamdaman ng
No, not
pasyente,
yet.
sir?
We have to evaluate.
You have to evaluate.
We have to check also the density of bone.
Mm-hmm.
Well, it depends on the density of bone.
So do you have to, sabi nga, you have to evaluate the density of the bone because it's very important because that nail has to be implanted into the bone. Then how will you assess, let's say, if the bone is capable of taking this dental implants?
Through X-rays.
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 Okay.
And also, while doing the procedure, you
Yes,
can
sir.
check the hardness of the bone, quality of the bone using the drill. We use drills.
Ganun lang ka-high-tech. But I thought before, the dental implants would be like, maybe it takes like weeks and months to have your
Kaya
that-
maraming
that thing
natatakot magpa-implant kasi
Kasi
akala
the
nila,
shape of the implant before was flat. So we have to
Flat.
cut the mandible open to place the implant. So ngayon, it's in the form of self-tapping screw. Na kung
So, parang-
ibabaon mo, maglalak na siya.
Igaganon mo lang yun, ha?
So, one way
Parang
to
gusto
check
ko na.
is the torque. No? Makikita natin yung torque.
Oo.
Pag nasabi natin na reach natin yung 65, 35 to 65, nakalak na sa bone, maganda ang stability, initial stability ng implant. Maaari natin siyang gamitin in 3 months' time. Or sometimes, pwede ka na maglagay ng temporary loading.
Okay.
Para
Wow, we have a lot of discussions, but we have to post for some reminders. And of course, we'll be, of course, again, we'll be with Dr. Buendia and some doctors with us. And we'll have like, isang hanging question lang. We will talk about, kumbaga mayroong skin whitening, tooth whitening. Ayan, napaka-popular yan. Okay, we'll be right back and after these few reminders.
Natural look nose lift, cleavage by breast augmentation, curves by liposuction, non-surgical treatment of varicose veins. Janssen Cosmetic Surgery by Dr. John Cenica.